The coronavirus pandemic continues to put a strain on the healthcare system. Cape Town's Groote Hospital has had to place organ transplants on hold. We speak now to Dr Elmi Muller, who's the head of the transplant unit at the hospital. Thank you so much for joining us, Elmi, and good morning to you. Just give us a sense of what's the knock-on effect of the coronavirus on organ transplant processes at Groote.
So obviously, when the coronavirus index case came to South Africa and the lockdown started, we had to plan for our hospital's resources, and that included planning for staff, planning for ICU beds, and planning for theatre time. And because of some restrictions on those things, we had to think carefully about all elective surgery, including transplantation. So we stopped doing transplantation just after the lockdown started, and it was really to try and make space for coronavirus patients in our hospital, but also concerns around patients who will be immune suppressed and possibly at higher risk if they contract coronavirus. So we haven't been able to perform transplants since March of this year.
That's a really long time, right? Because I imagine that many of the patients that you deal with are people who actually, it may be described as an elective surgery, but actually a lot of them are people who need these organ transplants in many cases to save their lives, right?
Correct. And of course, it does put a huge amount of pressure on our dialysis system, which in normal circumstances are already a very scarce resource. So one of the things that's happening as a result of this is that the strain on dialysis and the requirement for dialysis is increasing, and we're not able to help everybody. So it is a very dismal position to be in.
And you mentioned dialysis. What's the paint a picture for me? What's the picture in as far as the strain on that? Because a person is on dialysis pending an organ transplant. But if that's not happening, if that's not in the horizon, it means people are spending longer on the dialysis program.
That's correct, but unfortunately in the South African context, dialysis is not an unlimited resource. And we only have a certain amount of dialysis slots in our hospital and in our province. And the slots go open as we do transplants. So we do kidney transplants, we remove patients from dialysis, and then slots open up for new patients to start dialysis. Now, if we don't relieve the pressure on the dialysis by doing transplants, the dialysis program gets very full, and we are unable then to take new patients onto dialysis. So for kidney transplantation, although dialysis is a wonderful gap to take people who have renal failure to the place where they can receive a transplant, unfortunately, if the dialysis slots are full, we are in a position where we cannot offer that sort of chronic but very expensive long-term treatment option.
So I imagine that we must be at a point, Elmi, where we are losing patients, people losing their lives while waiting for an organ transplant because of the backlog.
That is true, but I do have to say that if you look at international reports, it is happening all across the world. And the outcomes for patients who receive fresh transplants who need to be quite severely immune suppressed if they contract coronavirus is extremely high in terms of mortality rates and pulmonary complications. So when you look at experience from Italy, Europe and the USA, many people express concerns doing fresh new transplants while the coronavirus is active. And part of our concern and why we did not do transplants was to try and protect patients from this risk. But of course, everything is a balance. And we're now at the point where the amount of patients needing organ transplantation is really piling up. And we feel that especially in the Western Cape, with the numbers coming down, that we do feel safe to start a transplant program again. We will, of course, select out patients very carefully to balance their own risk for COVID as well as the immune suppression that they will need.
What about the other side of the equation, Dr. Muller, around the donors, the organ donors? What's been the impact there? Because I don't imagine that many people, who would otherwise donate organs are that keen to come to a hospital, but also in as far as organ donors who have since passed on. I imagine that there must be a bit of a complication from a medical perspective, given the uncertainty around causes of death and what we still don't understand yet around the coronavirus.
Correct. So, as you know, there are two types of donors. There are the living donors and there are those donors who are deceased donors. So people who are brain dead and then donate their organs. So if we just look at those two groups separately, for living donors, these people are really very well people who've been worked up carefully. But our concern is that we are going to expose these people to SARS-CoV infection, especially in a hospital setting, so they will have a high risk to contract the virus, which we call nosocomial infection. So we don't really want to bring patients into the hospital who don't need to be here, and living donors are one of those groups. For the deceased donors, there are two concerns. The first is that if you use a deceased donor who has got COVID, there are not a lot of documentation around this yet, but it seems that there's a very high mortality rate for the recipient. So we have to carefully screen the deceased donor that this person doesn't have COVID. And the second issue here is a resource issue. So when our hospitals are really struggling to have enough beds for patients with COVID in our ICUs and enough ventilators, it becomes difficult for us to justify to look after a deceased donor who then occupies the ICU bed, occupies a ventilator till the time when we can take the organs. We've also been under a lot of strain in our operating theatres because of staffing and because of the fact that the anaesthetic staff needs to also cover now in ICUs and in COVID intubation teams, which means our operating rooms are much less than usual. And we have to then carefully decide who gets priority in the operating theatre. And usually now at the moment, we prioritise patients who come in with acute emergencies. So that's been the situation since the lockdown started in March.
All right, Dr. Muller, thank you so much for your insights there and all of the best as you try to pick up again on this crucial work that you're doing as far as organ donations and transplants are concerned there. She's from the Groote Schuur Hospital and giving us a sense there of how they are trying to sort of restart the processes around organ transplants because of the backlogs that have formed in the last few months.